Today we're going to be demonstrating how to place the drum catheter system. This is a system that is created by MILA. It's designed for sampling. It's a sterile enclosed package that includes a peripheral IV catheter and the drum catheter. So I have already taken one out. So my hands are not sterile, obviously. This is a demonstration. So I wanted to show you first what this looks like when it is not being utilized, and then I will show you how to place it. So basically, this is your regular run-of-the-mill IV catheter. You don't have to use this IV catheter. You can use your own, and as long as the size is appropriate, you can place it in the patient. The actual drum line is very simple, and it allows you to just feed this catheter through the other catheter, which I will show you in a moment. And then once you're settled, you open this up, and you lure lock this in place right here, and you take the stylet out, and then you add your T-set, okay? So I'm going to show it to you in a sterile manner now. So as you can see, I had prepared a sterile drum kit, sterile gloves. I have a sterile flush T-set, gauze, and a second pair of gloves. Because, as you also can see, my patient had a catheter placed. I had already aseptically placed a catheter and as sterilely as possible draped this patient. It is very important to realize that your T-set may be contaminated. So you might need an unsterile person to take off that T-set when you proceed with your sterile gloves. But in this context, I actually placed it sterilely because I knew I was going to be doing this in the video and I wanted you to see it in a sterile manner. So obviously, using sterile technique, glove up. Okay. So this is a nicely draped patient. This is obviously a mannequin and not a real patient, but it should work just as effectively. So what I'm going to do, and this is where you might need your non-sterile person to help you. If you think that it was contaminated, try to have another set of hands take this T-set off. And I'm going to just put this aside. So now that this is in place, I just will want to feed this line in. And if I have difficulties like this, that can happen because of the kinking. I could always, at any point, open this up and troubleshoot it. And this is actually kind of like a real life situation. See why it's important to be sterile and why you should have a drape. And now I'm hand feeding it. Look at that. It just feeds right in, lure locks in place. And now I remove my stylet and I place my brand new T-set. Now actually this is actually not flushed through. So I want to be aware of that because I want to aspirate this. Just like a central line, some people pre-flush and some people do not. So that's going to be a bit of your own user comfort. If you feel that you want to pre-flush, you can. So what I'm doing is just removing the air. And now I'm going to take my sterile flush. And I'm going to attach that and flush it. So now we have a line in place, and now everything is sterile, very clean. Everything that went in was very sterile. I'm confident that patient is had a good, clean placement. When I go to remove this drape, I now have to deal with a little bit of a challenge sometimes with the length of this. So you must be creative and do appropriate bandaging to support your T-set. In this particular patient, I put this catheter in super low because it's not a real dog and I would not have been able to feed it. But in a normal patient, this catheter wouldn't be so low. The catheter would be here or here. So you could imagine that I'd have more room to pad and create a nice modified Robert Jones bandage to support that catheter. So what I'm going to do is I can give fluids through this or I can draw blood. And it bleeds beautifully. I would use a 3-syringe technique just like you would with a central line to sample your patient and then return the sample back to the patient. If this catheter at any point kinks or clots, you could theoretically set up another sterile table, drape, and grab a new drum line and remove one and replace it. So you don't have to stick the animal, and that is actually a way to maintain that sampling line. As long as you maintain sterility and asepsis at all possible points during the placement.